Well, wonderful. I want to welcome all of our guests. I want to welcome all of our business partners. Oh my goodness. I've been so excited for this night to come. Finally, we've talked about this all month. For the month of July, our special guest, Dr. Russo. But before then, I want to just introduce our medical advisory board. We have on our panelist screen, and you can just give them a wave when I introduce you. We have Dr. Tyus Crawford Thomas, who is a family practitioner here in Chicago. She's part of our medical advisory board. We have Dr. Joyce Smith, who is our PharmD pharmacist here also in Chicago. We have also Shannon King, RN, is also with us. And Michelle Agnew, RN. Again, all of our medical advisory board offer alternatives to our patients. You know, offer a natural, organic alternative, which is cannabis, that you will hear more about tonight. So let me make sure I didn't leave anyone out. And Dr. Charlotte Mitchell is also one of our medical advisory board members. Dr. Charlotte Mitchell is an internal medicine doc. So thank you guys for joining us this evening. We'll hear more from you and questions if you have them once we complete our interview. So I am Dr. Rita McGuire, and I am the Chief Medical Officer for Wakanna. I'm also one of the co-founders. In the entire month of July, what we've done is we've looked at the clinical endocannabinoid deficiency. So the very first Wednesday in July, and don't worry, if you don't know what any of that means, you're going to hear more about it tonight from Dr. Russo. But the very first Wednesday, we kind of did an overview and really what the endocannabinoid system is and what it means to be deficient. The second Wednesday, we actually looked at one of the disease entities that make up the clinical endocannabinoid deficiency syndrome, and that is fibromyalgia. So we talked about fibromyalgia and how CBD can assist with symptoms that cause fibromyalgia. And then the third Wednesday, we looked at irritable bowel syndrome, and we looked at how CBD can assist those who suffer from irritable bowel syndrome. And then last Wednesday, we covered Parkinson's disease as it relates to the clinical endocannabinoid deficiency. So before I bring on our guests, I want to tell you a little bit about myself. Well, I'm a mom of 3 amazing adult children. Yay, they're adults. My oldest is Jacob, he's 29 years old. The middle child that's always making a face is Joshua, he's 24. And the baby girl, Hannah, is 22. So excited and proud to be a mom of 3 college graduates and 3 liabilities that are now out and off of my payroll. I am an obstetrician gynecologist. I've been practicing for over 30 years now, hard to believe. So yes, I'm still a practicing physician. I'm still doing hysterectomies and C-sections, but I've transitioned my gyne surgery to more cosmetic surgery. So doing more tummy tucks and liposuctions and things like that. So yes, I went from an OB-GYN that typically read a lot of our articles out of journals and publications to now a physician that totally is immersed with publications that talk about cannabis, that talk about the plant's medicinal properties, you know, from Time magazine all the way to Women in Weed, really helping to understand alternatives for my patients, because quite honestly, patients are looking for alternatives to their health right now. Patients are looking for alternatives that are natural, that are organic, and are affordable as well. So 3 years ago, I was introduced to CBD by the CEO of our company, Wakanna. And honestly, I had never heard of CBD. In fact, the only thing I knew about cannabis was when I would smell something that smelled like cannabis on my children, right? Outside of that, they don't teach us anything about cannabis in medical school or even residency. But I was honored and privileged to be asked by the governor of the state of Illinois to testify for the legalization and taxation of adult use cannabis here in Illinois. So Illinois, we are the 11th state to accept the adult use. In fact, when I was introduced to CBD 3 years ago, I was introduced to the hemp side of the plant. Now I am a certifying physician for our medical program here, as well as I was the first physician in the state of Illinois to certify a patient in our opioid exchange program. So that's a program where patients, instead of filling that prescription for an opioid, they can actually get a temporary medical card to have an alternative to treat their pain. So excited to be a part of this industry. I'm an advocate for this plant. I've seen hundreds and thousands of patients already improve from the medicinal benefits of this plant. So last year, I was so excited to finally meet Dr. Ethan Russo in person. See, when I began my journey in this industry and with the plant, the cannabis plant, I would frequently email Dr. Ethan Russo, and I don't even know if he remembers me, that annoying physician and colleague, just emailing him because I was fascinated with all of the research and all of the development that was going on behind this plant. So last year in September, I had the honor and privilege to speak at the Cannabis Science Conference in Portland, Oregon, along with Dr. Ethan Russo. In fact, Dr. Russo, I cannot find the picture that we took together, but we did take a picture with the Knox family. These are other colleagues that really are advocates with the alternative of giving their patients options and using cannabis. So I'm excited to bring up Dr. Ethan Russo. Dr. Ethan Russo is a board certified neurologist. He's a preeminent global medical cannabis expert. He's had 25 plus years of clinical cannabis research experience. He was part of the medical monitor study. He was the physician that actually worked with GW Pharmaceuticals in the clinical trials of Epidiolex and Sativex. And he's also the author of 50 plus peer review articles in journals and 7 books. So right now, I want to bring on Dr. Ethan Russo. He's also the founder and CEO of CannabisResearch.org and currently the co-founder of Credo Science. And Credo Science is doing some amazing, innovative things and studies and research with cannabis. I also want to say, I cannot leave you out, Dr. Joseph Rosado. We have another member of our medical advisory board, and Dr. Joseph Rosado, thank you for joining us out of Florida. But Dr. Ethan Russo, are you out there?
Good evening to everyone.
Good evening, Dr. Ethan Russo. How are you?
Well, better now that you can see and hear me.
Well, we are so excited to have you on. I don't know if you heard that we've been studying about the clinical endocannabinoid system deficiency, actually for the entire month of July. So we are hopefully going to have a clearer understanding when you go through some of the topics as it relates to the clinical endocannabinoid deficiency. So you've really been ahead of the curve when it comes to cannabinoid research and cannabinoids. Can you tell us a little bit about your background and how you became so interested in studying cannabinoids?
Sure, I'd be happy to. So I'm a board certified neurologist, but when I'd been in practice about 7 years in 1990, I really got in a rut in that I felt that I was treating my patients with more and more toxic chemicals with less and less benefit. And this directed me back to a childhood interest in medicinal plants. In 1994, I made my first trip to the Amazon jungle in Peru. And in 1995, I took a 3-month sabbatical working with the Machigenga tribe. After that, I was convinced that I wanted to make medicinal plants the focus of my career henceforth. By then it was 1996, and I quickly got embroiled in the cannabis controversy. That was the year of Prop 215 in California. So I intensively began to study and try to do clinical research, specifically on migraine. But I was blocked by the government from doing those studies. Along the way, I was reading more and more about cannabis and the endocannabinoid system, and published my first paper on migraine with cannabis in 1998 in the journal Pain. That was noticed by Jeffrey Guy, the founder and chairman of GW Pharmaceuticals, that went on to develop Sativex and Epidiolex. They asked me to be a scientific advisor. And then in 2003, I came on full-time for 11 years, and you mentioned that. Along the way, I was doing more writing and publishing and editing, and also joining in some of the cannabis societies, the International Cannabinoid Research Society and the International Association for Cannabinoid Medicines, eventually being an officer in those organizations. Subsequently, I've been in a couple of other private companies, and just this year with Nisha Whiteley, we've begun our own company, Credo Science. I'm afraid that in my prior companies, I didn't have the latitude that I felt I needed to pursue my own research interests. So we're trying to remedy that now.
Very good. That's very good. I'm excited for you. Congratulations as it relates to Credo Science. Excited to be a part of that research in any way if I can. So let's move on to CBD. And let's talk about what is the significance of CBD? You know, how does it work in the body?
Sure. Well, CBD has been known about for a long time. Its structure was actually figured out in 1963 by Professor Meshulam in Israel. That was the year before they managed the same thing with THC. But THC got all the attention, and for decades, CBD was sort of the redheaded stepchild. There were people that went so far as to say that it was inactive. They had all this wild psychoactivity with THC. CBD didn't do that, but there were people that remained interested, particularly Professor Meshulam. Also, Professor Carlini and his acolytes in Brazil did a great deal of study over the decades using CBD to treat anxiety, seizures, etc. And then again, in the late 90s, GW Pharmaceuticals was very interested in the CBD. They had a CBD line of plants, high CBD, and funded a great deal of basic science research in the early years of this century, and subsequently developed Epidiolex, which is an almost pure form of CBD, to treat these severe epilepsy syndromes, Dravet and Lennox-Gastaut syndrome. It's also been successfully used in clinical trials at high doses to treat schizophrenia. And many people around the world have come to understand that it's a very versatile medicine for treating a large number of conditions.
And so how does it work in the body, if you can tell us?
Oh boy, that could be the rest of the night. There are about 30 separate mechanisms of action. One thing that's interesting about CBD is it doesn't bind to the CB1 receptor directly the way THC does. So that's why it doesn't produce a high. It actually binds to another site and changes the way that THC binds. So it actually is what's called a negative allosteric modulator. Breaking that down, basically it complements what THC does. Both are painkillers and anti-inflammatories, but CBD is able to block some of the side effects of THC, specifically rapid heart rate and anxiety. Too much THC, excessive doses can make people feel crazy, and CBD counteracts that as well. But beyond that, it exerts a lot of actions via another receptor, the serotonin 1A receptor. That's the basis of CBD's ability to be an anti-nausea drug, as well as a lot of other mechanisms of action, specifically on anxiety, etc. And then, again, as an antipsychotic, and it's just been shown recently in a study that it works on seizures via another receptor, what's called the TRPV1 receptor. That's a weird one because TRPV1 is where capsaicin, the hot stuff in chili peppers, works, but we actually have TRPV1 receptors in the brain. And like so many other systems in the brain, this relates to epilepsy, and it's a unique mechanism of action that isn't active with any of the other anticonvulsants. So that's just the beginning. There are also effects. It is an antioxidant. It's stronger than vitamin C or vitamin E. It has neuroprotective effects, prevents brain damage from strokes, head injuries, and things of this sort. So pretty remarkable.
Awesome. So when we talk about the clinical endocannabinoid deficiency syndrome, what prompted you to even start that research? What really made you look at that in 2001 and 2003 to start figuring out that it could be the reason why we see what we see?
Yeah, well, you know, it's a thought process that evolved. As a neurologist, I was well aware that a lot of the diseases that we get, particularly with aging, relate to deficiencies of neurotransmitters. So one of the problems in Alzheimer's disease and dementia is a lack of acetylcholine, the memory molecule in the brain. On some level, depression relates to deficiencies of serotonin. In Parkinson's disease, we've got a deficiency of dopamine. So I thought, if there are deficiency disorders of these neurotransmitters, why not the same in the endocannabinoid system? I'm sure your audience is aware that we have natural cannabinoids called endocannabinoids, and what would happen if those were deficient? Well, we know that the endocannabinoid system modulates pain. It also has an effect on anxiety and other emotions. It relates to gut function, how fast things move, everything else. So if someone were deficient, we might expect that they had pain where we don't see anything wrong, but yet pain is clear. And they could well have mood disorders, depression, and anxiety. They would have a gut that was upset and didn't work properly, and they'd likely be susceptible to headaches. So it immediately occurred to me that there were 3 disorders that were prime candidates for being clinical endocannabinoid deficiencies. And those were migraine, fibromyalgia, and irritable bowel syndrome. So these are 3 things that you've presented earlier in the month. And these have a lot in common. When a person has a tendency towards one, they seemingly are quite susceptible to having one or both of the other 2. So these are what are called comorbid conditions. They also have in common that they are diagnoses of exclusion, meaning we don't have blood tests for them. You fit a clinical pattern, and then maybe the doctor will do a bunch of tests that don't show anything, and they'll say, well, we didn't see, you don't have a tumor, so it's irritable bowel syndrome. Again, all of them have a situation where they're associated with pain, but the tissue looks okay. So a lot of people have thought of these in the past as being psychosomatic conditions. I'm here to tell you that I don't think there is anything as psychosomatic, because this all relates to biochemistry. So anyway, I presented this theory first in 2001, then expanded upon it in 2004 and 2016. Along the way, we've gotten a lot of supportive evidence from additional studies. Just one example I think would be good. I had hypothesized that there would be a deficiency of endocannabinoids in migraine, and then a study was done in Italy in 2008 in which they took samples of cerebrospinal fluid that surrounds the brain and spinal cord by doing spinal taps, lumbar punctures, and they showed a remarkable difference between the low levels of anandamide, one of the endocannabinoids, in people with migraine versus people who did not have it. So this was our first objective proof of the existence of a clinical endocannabinoid deficiency. But we've seen a lot of other support for things, other disorders, including autism, and also in PTSD. People who were exposed to the 9/11 catastrophe who developed PTSD also have been measured to have endocannabinoid deficiencies, as compared to people who were there but for whatever reason didn't develop post-traumatic stress. So those are a few examples, but at this point, I'm pleased to say that this has been recognized. It's been cited in the literature something like 300 times. Not everyone is convinced yet that such a thing exists, but I sure am, because we see it in our patients all the time.
Fantastic. When we talk about the clinical endocannabinoid deficiency syndrome, and we look at a lot of things that we're undergoing, the stress of the pandemic, social unrest, how does lifestyle and diet fit in to your endocannabinoid system being deficient?
Sure. Well, I'm really pleased you asked that. Obviously, the first thing that comes to mind is if you're deficient in endocannabinoid function, maybe you need external supplementation, and that could be provided by cannabis, particularly very low amounts of THC, just to jumpstart the system. But there are two other things that are preeminent in trying to deal with this kind of situation. I recommend these for everyone, and they are low impact aerobic exercise. We know exercise is really good for you. There's evidence that the so-called runner's high that some people get, never had it myself, but that's based on the endocannabinoid system and not endorphins as people had previously thought of. So that's one. And the other is diet. My personal feeling is a great deal of this could be related to a lousy American diet. American diet, and I mean fast food, a lot of carbs, is very pro-inflammatory. Instead, we need to eat more like our forebears did, which would be a more anti-inflammatory profile, and particularly emphasizing probiotics and prebiotics. So most of our traditional cultures always had a fermented food that was part of their routine. And if you look at different cultures, it's almost always this kind of thing, almost anywhere you go in the world. So this relates to the so-called microbiome. These are the bacteria in the gut that have so much to do with proper nutrition, getting the right neurotransmitters from the gut to the brain and everything else. And then prebiotics are the foods that the feedstock for those good bacteria. And this includes things like a lot of vegetables with indigestible fiber, burdock, acacia, but a lot of green vegetables would qualify, and a lot of bitter substances that Americans just avoid for the sweet and the fat. But combination of prebiotics and probiotics, particularly in conjunction with an aerobic activity program, can likely significantly ameliorate a lot of clinical endocannabinoid deficiencies. And there are relationships to autoimmune disorders as well. We've seen an explosion of the latter. And people have said, well, it's just a matter of recognition. I don't think so. These things were distinctly rare in humans in the past and very common now. So yeah, stress is a factor, but I think a lot of this is based on diet and sedentary lifestyle.
Absolutely. You know, when I was in medical school in the early 1990s, I think I saw only one patient with lupus. I mean, autoimmune diseases, you know, we just didn't see. But, now we're seeing more and more prevalence of that. Tell me about the other part of the plant, terpenes. You know, we talk about terpenes on our certifications every month, and what is their role as it relates to the endocannabinoid system and improving our overall health?
Sure. So terpenes are aromatic components of the plant. And they're actually what gives cannabis its characteristic odor. It's not the cannabinoids. They don't smell at all, oddly enough. They're produced in the same place, the glandular trichomes of the unfertilized female flowers. A lot of these would be very familiar to people. So any citrus fruit, if you take your thumb across the rind, you're releasing a lot of limonene. This is the lemon scent we think of, but it's also in oranges and limes. And they've got other components that change the smell so you can tell them apart. But limonene is a very strong antidepressant, mood elevator, and immune stimulant. So it's very complementary to what the cannabinoids do. One of the terpenoids called caryophyllene is also a cannabinoid. It's working at the CB2 receptor. That is the non-psychoactive receptor that's out in the body that relates to, well, it has an effect as an antifibrotic, it reduces pain, and it's also immunomodulatory. So that's a great example to use of the direct relationship. But otherwise, the terpenes are synergists that work with the cannabinoids in what we call the entourage effect. That would be the idea. You could think of THC and CBD as the soloists, and the terpenoids would be members of the orchestra. And hopefully, when they play together, you have a beautiful harmony.
Very good. The entourage effect, which we've heard of many, many times. So my last question, as it relates to the clinical endocannabinoid deficiency, what would you say is the percentage of chronic illnesses that we see today when we include obesity, diabetes, heart disease, hypertension, all of the arthritis, be it osteo, rheumatoid? What percentage would you say is a direct correlation to the endocannabinoid system being deficient in endogenous cannabinoids that our body should be producing?
Sure. Well, I'm not the only one to say that there is a role for the endocannabinoid system in almost any disorder because it's the great homeostatic regulator, the thing that keeps our physiology, how we work, in balance. And this applies to whatever system you want to name: digestion, emotion, cardiac function, sexual function. There's always a role and a modulating effect for the ECS. So this makes it much less mysterious why we find a role for cannabis in treating so many different disorders. And that's not to say that it cures everything. You know, it really can help many conditions, however, and that is a true statement.
Very good. So thank you so much. We're going to just take some questions. I know I promised I wouldn't keep you long, but we're going to take some questions first from our medical advisory panel. If you have a question for Dr. Ethan Russo, you can unmute yourself. If you are an attendee, you can put your question in the chat box.
I have one question, Dr. Russo. With all the research that's being taking place right now, how do you see cannabinoids or especially CBD, migrating into the mainstream of treatment for plans for patients that suffering from the neuro disorders, such as like acute spinal cord injury. How do you see that going forth? And how long do you think it would be mainstream into the treatment plans?
Yeah, well, thanks, Michelle. I think it's going to be a slow evolution. This is one of those things where the public gets it and is using CBD extensively already. And the knowledge has only transferred very slowly to the physician community. So this is still a new thing. As we heard previously, this is just not something that's taught in medical school to any degree. Not only do they not teach about cannabis, the endocannabinoid system, which is at the root of so important to how we function, isn't taught either. There's been real resistance to it. Basically, they say the curriculum's full and they don't have time. So I think it's going to be a slow evolution. Certainly with the advent of Epidiolex as the first prescription cannabis-derived product that was FDA approved, this will slowly filter out into a greater awareness. And my suspicion is, unfortunately, because of the cost and everything else, it's unlikely that that's going to be used off-label for other conditions where we know it'd be helpful. And that could be so many things, the most obvious being treatment of schizophrenia. But as a pure compound, the doses that they require are very high, and it really adds to the cost. Something I should mention about CBD is it is really versatile, but it's not particularly potent. That means that we need a higher level of number of milligrams to treat the average condition. And my bias is that it works better with the full panoply of other chemicals in cannabis. So I'm a proponent of whole plant extracts, especially. In terms of spinal cord injury, I think CBD could be a useful adjunct, but the real value seems to come from THC in that instance, particularly dealing with the spasticity, the muscle tightness that is one of the major impediments after a spinal injury. Also, treating pain, you really need both, ideally. THC is the more effective at pain at lower doses, and the CBD is always really helpful in reducing the side effect profile of THC so that it is a better medicine. What we call it is increasing the therapeutic index. That means the dose that you can get to before side effects appear. Thanks.
Dr. Russo, this past Saturday, I heard you speak at the event that was held in Columbia. And in the Q&A portion, a question came up regarding acute pain versus chronic pain. Now, I've partnered with a pain management clinic where we work on weaning patients off of opiates and transition them and use phytocannabinoids to address their pain. Many of those patients have suffered acute injuries and have utilized the cannabis rather than the opiates and have found pain relief. However, I seem to have recalled you as well as others say that phytocannabinoids work better for chronic pain and not so much acute pain. Would you mind clarifying that, please?
Sure. Well, I think what I said on Saturday was if you have a tooth pulled or have a dental procedure, you don't want THC at the time, with the exception possibly of conjunction with opiates so that a lower dose can be utilized. But when somebody has an acute pain, if it develops into a chronic pain, there's always going to be a role for cannabis-based treatment. Cannabis really excels in the more chronic types of pain, particularly when it's neuropathic pain, pain with nerve-like component, burning pain in the limbs, things of this sort. But yeah, it's just when cannabis, or specifically THC most often, has been looked at experimentally in acute pain or in pain models in the lab, the results have been equivocal at best, and sometimes people have felt worse. So again, I'd make that distinction. If I can, I see from the chat a question, or maybe the panelists haven't all gotten their chance.
You can take a question from the chat. There's a question about.
Sure. Yeah, there's a question about Will I Am asks how CBG, cannabigerol, plays a role in endocannabinoid health. I think CBG is the next big thing. So this is sort of like the parent cannabinoid in the plant. Usually the plant doesn't quit there. It goes quickly from it on to THC and CBD. But CBG is also very versatile. It's not intoxicating the way THC is, but it has a very pronounced anti-anxiety effect without being sedating. So that's a very interesting profile. Additionally, it works on a thing called the TRPM8 receptor that seems to be important in prostate cancer, and goodness knows we have a lot of that in our society. And it has a mild effect to lower blood pressure and intraocular pressure, and has a muscle relaxant effect, again, without producing weakness. So I see this as being potentially the next big thing. Where I live in the Pacific Northwest, there's a lot of CBG already available. They're growing great amounts of it in Oregon. I don't think it's really been widely available in other parts of the country, but hopefully that will change soon.
Thank you so much. Another question, how effective is CBD for glaucoma reversal?
Complicated. THC is the agent that primarily is useful in reducing intraocular pressure. CBD actually doesn't change the pressure. However, glaucoma isn't just about pressure in the eye. It actually is a neurodegenerative disease of the retina, which is part of the brain. My feeling is that a good program for glaucoma would include both THC and CBD, and we would want the CBD for two reasons: to reduce the side effect profile of THC, and additionally as a neuroprotective agent that might slow down the degeneration of the retina that accompanies chronic cases of glaucoma.
Thank you. Another question about autism and CBD.
Again, that one's complicated. My colleague Bonnie Goldstein has tremendous experience with this, and I'm going to go with her recommendations. She finds that low doses of CBD sometimes have a paradoxical effect, which is to say that it may make affected children more excitable. And she finds that higher doses are needed, at least 50 milligrams twice a day. And autism isn't one thing, it's a spectrum disorder that we see in a bunch of different contexts. And so it often is the case that a lot of experimentation is needed. THC has a more pronounced effect on its own. Again, both may be a good thing. And there also has been a role for THCA, which is what's found in the raw plant before it's heated. Yeah, it requires a little bit of trial and error.
Perfect. Would CBD be helpful in someone who's on dialysis?
It is not going to reverse the process. However, it can be very good in reducing associated symptoms, including anxiety, itch, sleeplessness, pain, the kinds of things that accompany renal failure, particularly in diabetic patients. There are lots of aspects of diabetes where cannabis-based treatment is going to be helpful.
Wonderful. CBD and COVID-19.
Oh, tough one. Yeah, really the answers aren't in yet. There have been a couple of studies I can talk about. One was a study in Canada. It was available as a preprint. I don't think it's still been formally published and subject to peer review. This is a little complicated, but I'll try and run through it. What they looked at was cannabis extracts with CBD in them. And there were different ones. And they noted that some of the extracts were able to lower the amount of the ACE2 receptor, which is where the virus binds to get into the cells. However, it didn't relate to the concentration of CBD in the extracts. So I think it was something else. Plus, I don't think that we have proof yet that lowering the number of receptors prevents infection. Maybe it does, but I don't know that that's been proven. And then there's work in Israel that was in the news. Again, I haven't seen the study, but it was some combination of CBD and terpenoids together was reported to be beneficial. As are more effective than dexamethasone, the steroid that's been used to treat severely affected patients with a cytokine storm. Now, I will say, on a theoretical basis, we've got a lot of reason to think that CBD could be helpful in those severe situations, but I'm really hesitant to say that this is proven. We really need more evidence in real life from patients to know that. And because this isn't going to be freely available in hospitals where the more severe cases will be seen, it's going to be a hard thing to establish. Yeah, it's intriguing at this point, but that's about the most we can say.
Wonderful. We're going to take one last question because
I have a question.
Yes.
Hi. I find that there's been a trend with people that typically use high THC, and there's been a trend with them buying more CBD. What would you really attribute that to? Because they're not getting the high that they're getting with THC. So what would you attribute this trend to?
I think that they're health conscious and they are trying to treat something. Certainly nobody takes CBD to make them feel good. They may be taking it to make them feel better in terms of symptom reduction. But, you know, traditionally we've heard that CBD is a buzzkill. People tended to avoid it and go for the THC, and that's still true in the recreational market. But it doesn't need to be that way. CBD can really enhance the experience even for people who are using it in the so-called recreational setting. So again, hopefully we're going to see an evolution as people understand more of the potential of the plant and different combinations to enhance their lives. So hopefully we'll see that.
Thank you.
Wonderful. So they're asking about dialysis and pancreatitis. Pancreatitis and CBD.
Again, what we know is THC has shown benefit in treating pancreatic pain, which is one of the most difficult pains for traditional medicine to treat. Again, as an adjunct, I think CBD could be helpful, but as a standalone drug, I wouldn't expect it to have a major effect.
Thank you so much. Thank you so much. The panel, did everyone get their question answered? Panel? Yes? Dr. Tyus has one more question.
Yes, I have a question. You had mentioned with the exercise and the diet, you know, helping out with CBD. As a marathoner athlete, how would you see CBD having some role with athletics and performance in general? I know, I think I recently saw a study where the NFL or something, they were allowing some of the players to have the CBD.
Right. I've met a lot of athletes now that swear by CBD and find it a great substitute for the kinds of benzodiazepines and opiates that team physicians have traditionally given people to try and keep them in the game, literally. So another intriguing fact is that CBD has been shown to accelerate bone fracture healing. So there's certainly a role there. But it's easy to understand with its pain-killing properties and its anti-inflammatory effects that it would be tailor-made for people with athletic injuries. So it's very, very sensible.
Fantastic. So Dr. Russo, would you mind leaving your contact information?
Sure. My email is just Ethan Russo, one word, at comcast.net.
Kathy, can you type that in the chat box? Ethan Russo,
Doing it right now.
at comcast.net. Well, we want to thank you so much for joining us tonight, Dr. Ethan Russo, the physician that discovered the clinical endocannabinoid deficiency syndrome. We are so honored. We're so excited. We're going to have you back on soon so that we can get more information as your research evolves. Congratulations on Credo Science. Excited about that as well. But thank you again for joining.
Thank you, and good night to everyone.
Good night. Wonderful. So what we're going to do now, we have 7 minutes left. And in those 7 minutes, we are going to go over some of our products here that we have at Wakanna. You can continue to put those questions in the chat box. I absolutely can get those questions over to Dr. Russo for your answers there. So let's see if we can share the screen. We have 7 more minutes before we have to end our call. But what we're going to do is just talk about some of our products here at Wakanna. We offer, organic, full spectrum and broad spectrum products, CBD products. The FDA disclaimer just states that these products have not been approved by the FDA. So if you're pregnant, nursing, on medication, please consult your physician prior to using cannabis products. So our product line, again, the power line with the black labeling is our full spectrum product. That means it contains the terpenes we talked about, the CBD, the CBN, the CBG, also the CBC, as well as the legal limit of THC, which is 0.3% or less. Because our products are extracted from the hemp species of the cannabis plant, the CBD products will not get you high. You will not get a paranoia. You will not get a euphoria, but it will help you to be less anxious, more calm, the ability to deal with all of the things that we're dealing with this pandemic, social unrest, etc. Then our pure product line is our broad spectrum line. That's a line of products that can be used by those who may be on the webinar that have urine drug screens, right? The pure line contains less than 0.0% of THC. What is critical in this marketplace are certificates of analysis. Certificates of analysis allows all of our customers to feel very comfortable that what is in the bottle and on the label is true. So our certificates of analysis are full panel. They will let you know about the pesticides, heavy metals, any microbiological contaminants. All of these things are critical. Why? Because you can find CBD products at the gas station, at the smoke shop, at the video store. So you want to ensure that your product is safe and effective. Even the potency, the milligram for milligram, should be available on every product when you're looking at a CBD product. So let's look at our tinctures. Tinctures are products that you use under the tongue. They're oils. And it's important when you use a tincture that you hold it for 60 seconds before you swallow. So we have 3 tinctures. We have our Hempranium MD, which is 750 milligrams of CBD in a 15 ml bottle. This is a great product for those who have severe challenges that they're trying to address. And then our 500 milligram, which is a tincture that has a proprietary formulation. We've enhanced our CBD with black seed turmeric and peppermint. Those are 3 USDA organic essential oils to help enhance the anti-inflammatory and antioxidative properties of the CBD. And then we have a pure, our broad spectrum tincture that allows those who have random drug screens to use as well. This is a 300 milligram in a 15 ml bottle. Our pure products have a special delivery mechanism. It's called nanotechnology. Nanotechnology allows the CBD molecule to become more water soluble, which it makes it more bioavailable to the cell. So this is a product that's 98.7% bioavailable. So when you're introducing CBD to your host, to your body, it's important to start low and slow. I recommend 3 drops in the morning and 3 drops in the evening. That's a great way to start. That'll give you between 10 and 12 milligrams of CBD on a daily dose. More is not better, right? We also have topical products. Topicals offer local relief and offer faster relief for those who are looking for those, let's see, something happened. My slide just, it offers local relief to those who have those achy joints and muscles. In fact, I use the topical before I work out. I use it at night, so I'm not in any discomfort when I'm trying to sleep. Our topicals come in a oil-based form, Dr. Rita's rub on the left, and then a cream form, the 2 on the right. Again, if you have random drug screens at your job, topicals do not pass the blood-brain barrier, so they can be used for those who have random drug screens. And then our gummies. My goodness, these gummies are very unique as well. Our gummies are infused. They're not coated, which means the CBD is infused within the entire gummy, which makes it more potent. Our gummies, our full spectrum gummies, are 25 milligrams per gummy. They're vegan, they're non-GMO, and they really assist with all of the things that we talked about that CBD can assist with inflammation, pain, even sex, even improving that libido, inflammation. These gummies come in a 20-count pack or a 4-count pack. We also have gummies for those who have random drug screens at their job. Our pure gummies are 20 milligrams of CBD. They are infused. They're vegan, non-GMO, and they also come in a 25-count pack or a 5-count package. Now, gummies take about 30, sometimes 90 minutes to get into the bloodstream. So I take a gummy every night about 30 minutes before I retire. The tinctures, I failed to mention, they take about 15 minutes to get into the bloodstream, and those topicals work pretty quickly. And then we have CBD joints and cartridges. Our CBD joints are 106 milligrams of CBD, so you don't need to smoke the entire joint at one time. No one needs that much CBD at one time. Our cartridges contain 100 milligrams or 250 milligrams in a 0.5 ml cartridge, but I love CBD joints and cartridges because the onset of action is within 1 to 5 minutes. So when you're trying to deal with an acute issue, a CBD joint or cartridge is the way to go to address that acute issue, while the tinctures, the gummies, and the topicals are working in your system. And then we have a whole line of products for the kitchen. Our CBD Culinary line includes CBD spices, our garlic fire, our flavor king, our chili lime. Oh my goodness. 200 milligrams of CBD infused in the spices. We have a water soluble product, which is our power water soluble, which means you can infuse it in your smoothies, your water, your beverages, your food, and even a culinary product that you can bake with, you can cook with. We're hoping that you're not baking and cooking a lot of brownies and cookies, but absolutely you can use CBD in the kitchen. Along with our CBD culinary oil. It's a product that you can marinate your fish, you can use in your salad dressings. But just know these are all power products. So if you have random drug screens at your job, these particular products you don't want to use. So yes, you can be a Wakanna chef. You can be a Wakanna bud tender. We have a lot of fun with our products as well. And then we have to talk about our defense products. Our defense products are particularly important during this pandemic, right? Every single week I say, we cannot control this virus, but we can control the host. We can control our body, right? Last Wednesday, you all know, I was diagnosed as being COVID-19 positive. I've not had any symptoms. I've not been sick. I've not had a temperature. I've had nothing. Thank God. But what I do know is that I eat well. I eat clean. I work out every day. I have these amazing products in my body. So if any time ever in your life, the time is now to make sure that your immune system is the healthiest and strongest if it meets COVID-19. So we have something called our essential defense and our first defense. These are two products. One on the right contains 500 milligrams of CBD. It's a nasal product. It's an oil that has essential oils that help to really provide protection of our respiratory area. And then I just want to end by saying we have so many packages and bundles. If you want to try some of our products, we have a entire package that's a power package with all of the power products that include the gummies, the tinctures, the pre-rolls, the topicals. We have a pure package that also contains the pure products, the broad spectrum products for those who have random drug screens at their job. And then we have a variety package that has a variety of pure and power and tinctures and pre-rolls and water solubles. So a great, great way to save hundreds of dollars when you purchase our packages and even our defense package. If you want to really address your immune system, we have our essential oils, our black seed, our eucalyptus, our peppermint, our tea tree. We have an immune defense tea. We have our first defense, our essential defense. All of these amazing products where you're saving over $100+. So at this time, I'm going to take questions because I'm sure there are more questions out there. I'm going to stop sharing the screen. I know we've run over. We are 4 minutes over our time, but if you have any questions, you can put them there in the chat box. You can put them in the Q&A box. You can unmute yourself if you're a panelist, if you want to say or add anything. Let's see if there's questions here. Well, we're seeing just a lot of great feedback. Phenomenal, phenomenal. Thank you, Dr. Russo. Outstanding, amazing, great education. Thank you, everyone, for those kind words. So there may be a little confusion. Bob Christmas says, is CBD or THC better for Parkinson's or fibromyalgia? Well, our products are full spectrum products, the power line. So that means that we're using the whole plant. And that's really important. That's the message that Dr. Russo was trying to drive at. You know, isolates, when you take just that one molecule like CBD, it doesn't have that entourage effect on a cellular level. So when you take the cannabinoids like CBD and CBG and CBN and CBC and the legal limit of THC, and you combine all of those things, that synergy has a more profound effect when we're talking about disorders like Parkinson's and fibromyalgia. If you weren't on the line, I have an entire YouTube of videos where you can go back and look at our discussion about fibromyalgia and Parkinson's. And the reason why a full spectrum product is much more advantageous when you're dealing with such chronic disease entities is because that full plant can then address inflammation. It can address the antioxidative properties, and all the cannabinoids possess different amounts of those properties. So when you put them all together, it's much more powerful than just using one particular cannabinoid. So hopefully that answered your question. What would you recommend for eczema, itching, laceration, redness? Ooh, that's a lot going on. You know, when we have eczema, we think about skin disorders. The endocannabinoid system has receptors on the skin. What happens in eczema and psoriasis and all of those skin disorders where there's a layer of inflammation, there's a disruption in the immune cells called the Langerhans cells of the skin. So CBD can come in and decrease the inflammation. CBD has also been shown to have antibacterial properties, so that's why it's very helpful even in acne. So yes, because of the endocannabinoid system and the receptors on the skin, these tinctures, these products are very efficacious when we're dealing with symptoms due to eczema, symptoms due to to psoriasis as well. Thank you so much, Dr. Rita. Glad you have a strong immune system. Yes, thank you. I am so happy. Yes, yes, yes. CBD helps with the libido. Again, the endocannabinoid system has receptors in every single organ and gland in our body, including the reproductive organs and glands. So how does it help women who are menopausal? Well, menopausal women actually have a decrease in estrogen. So when they have a decrease in estrogen, their libido falls, the vaginal lubrication falls, and so they need help. And so CBD can come in. We have a topical CBD lube that can help to enhance the sexual arousal, the increase the libido, and the overall experience in the bedroom. So I'm going to take one last question because I don't want to keep it past 9:10. Yes.
Dr. Rita, there's a repeat question in the answer of the Q&A session about diabetes and its safety.
Oh, so diabetes. So diabetes, again, is a chronic illness that is along with obesity, hypertension, and heart disease, the arthritis. They all have a common denominator of inflammation. So we have inflammation around what we call the beta cells of the pancreas. And the pancreas is the organ that produces insulin. So when we see type 1, specifically type 1 patients, they're insulin resistant. Those beta cells can't produce that insulin. Type 2 diabetics, that insulin resistance comes from the inflammation of the beta cells. So if we can reduce inflammation, that is number one key to reversing a lot of these chronic illnesses that involve inflammation. So CBD is an anti-inflammatory. It helps to reduce inflammation in our body. You couple that with Dr. Russo, you know, you heard him, with a diet that's anti-inflammatory, with fresh fruits and vegetables. You combine that with exercise. You combine all of that with CBD, that's when it becomes magical. That's when the CBD can really get into the system and work, right? So you can't continue to eat fried chicken and cookies and cakes and take CBD and think that your diabetes is going to get better. It probably will get a little better, but it's much more advantageous to really look at your diet, look at the foods you're eating that increase inflammation in your body, reduce the inflammation, get active. The CBD products will decrease the inflammation, and then you have magic that happens. That's a real entourage effect that's going on. So that's how CBD works with diabetes. That's how CBD works with all of these chronic illnesses that we're seeing today that involve inflammation, your lupus, your fibromyalgias, your depression, your anxiety, your insomnia. All of these have a common denominator of inflammation. So let's get the inflammation down and we can really have the quality of life that we deserve. Any other comments? Well, thank you so much for being patient tonight. You guys were amazing. We are so excited because Dr. Joseph Rosado has agreed to be one of my guest speakers. He is amazing. He's in the cannabis industry, research, everything. He has just been another mentor of mine out in Florida. So have an amazing evening. We will see you tomorrow evening. Oh, I've got to show my slide. We're going to see you tomorrow evening at 8 p.m. We're having a overview, business overview. Minister Mooney will be on at 8 p.m. Central Standard Time. Please dial in. There's the Zoom link. Please contact the person that invited you on this line so that you can get the rest of your questions answered. You can get your products ordered, and you can also look at locking arms with us here at Wakanna. So have an amazing rest of your night. Panel, I want to thank you panelists for being there. My medical advisory board here at Wakanna, I want to thank all of you as well. Have an amazing night, and we'll see you later.